And then for the next few slides, I'm going to be honoring someone who was a long-term member of our society, Andy Porter, who died in August last year. His name may not be familiar to you, but I hope that in the next few slides you'll understand the importance of his work and the way Andy was. I should add that Andy was my first line manager in the UK when I came over from Spain in 1995, and I worked with him for 6.5 years at the Clinical Sciences Centre, then called CSC, in Hammersmith Hospital. So Andy was effectively one of us with a classical career, first degree, PhD, first, second postdoc, university research fellowship in Oxford. On the back of his results, he became a group leader for the MRC in London and eventually a reader with Imperial College. And Andy was really fascinated with DNA replication, repair, and expression, and particularly genetic engineering. That was really important to him. And in discussion with Andy many years back, he pointed out how these two papers from Mario Capecchi and Oliver Smithis got him going in this field, then called gene targeting, what we call today genome editing. And very quickly, Andy came up with a set of papers within 3 years of those two being published that were really seminal in the field, demonstrating double knockouts, demonstrating targeted breakage of a chromosome, and demonstrated that you could convert an endogenous gene into an inducible one. So this was really pioneering work on genome editing well before any chimeric nucleases were available. And this was not just technicalities. At the time, we understood perfectly, Andy understood perfectly, that this was going to be towards gene therapy. But we are talking 25 years before Casgevy was approved last year. Sadly, just a little after Andy passed away. Andy was a bench scientist. He really trained people himself, and he devoted enormous amounts of time to do that. And in some cases, really of his own time, being really, really generous with his own time. He was kind, he was patient, he would help everyone and ensured that he saw his students all the way through to completion in a really kind manner. And when it was necessary, and I'm not highlighting this paper because it's one of mine at the time, but because Andy actually drafted it, because I couldn't see a way to put these results together at the time when I left the group, and Andy, without a fuss, just took it on, prepared a draft, and saw it all the way through completion. So one more way in which he taught you how to do things. So getting the job done himself. And in the course of the pandemic, to make himself useful, he started doing face shields at home in a process that was kick-started by his son, Alex, and a bunch of other people, helping to overcome the shortage of PPE in the pandemic. And Andy was, at the end of the day, just kind. Just two anecdotes of his. I remember soon after I joined the lab that one of the lady cleaners came into the office, saw a tin of biscuits, and asked Andy for the tin, which was empty at the time. And Andy was taken aback and just said, I actually use it. Well, the next day, there was a full tin of biscuits for the lady brought by Andy. And obviously, everyone was really affected by the pandemic. But what was close to heart for Andy was the fact that he could not visit his mom at the time. And when Andy, for his own cancer care, had to go into self-isolation, again, not being able to visit his mom is what was really, really hard for him. So that's the kind of person Andy was. So really, just to close with this sort of small obituary of Andy. Andy, rest in peace. We'll always remember you.